Retrograde nerve-sparing robotic radical prostatectomy. What is it? It is a minimal invasive way of treating prostate cancer by removing the whole prostate gland. Robotics means that we're allowed to use keyhole instruments with the fine control that the robotic computer offers. Now, when we remove the prostate, we can cause the ability of a man to lose the strength of his erections. The ability of that gentleman to retain the strength of his erections is really dictated by the nerve spare and the nerve spare technique. What a retrograde nerve spare is a unique way to remove the nerves from the bottom of the prostate back to the top of the prostate, or from the apex of the prostate to the base of the prostate. Most surgeons perform very good nerve spares doing it the other way traditionally, which is from the top of the prostate to the bottom. That's called an antegrade nerve spare. There's a handful of techniques, and perhaps retrograde nerve spare is one of those few techniques that are quite difficult to learn. I've been lucky enough to be trained by a high volume institute in Florida, United States, to do this retrograde nerve spare, and it's what I offer my patients for my practice. If someone is diagnosed with prostate cancer confined to the prostate gland, usually it's on one side or even both sides of the prostate, and there is no spread outside of that gland. It can be treated in usually two ways when we speak about the whole gland being treated. Radical radiotherapy is a very good treatment, and that includes external radiotherapy or radiotherapy seeds, that's called brachytherapy. Or some patients prefer to have the whole gland removed so that their PSA blood test can go to undetectable levels, and you have a more sure way of monitoring their progress after. Prostate removal has side effects, and it's important that you attend to a surgeon who has experience in novel techniques and tracks their results and their outcomes. So prostatectomy is something that I think is a very good treatment for one who is fit for a general anesthetic. It asks a lot of you from your physiology, but the recovery is great. You can go home the next day or the day after. And that means that you don't have to deal with the radiotherapy coming to sessions of radiation treatment, or dealing with the radiotherapy seeds and always thinking your prostate gland is still there. Will the cancer come back in some shape or form? The benefits of choosing a retrograde nerve spare robotic radical prostatectomy is that the nerves are released in a manner that is not commonly practiced, as in the nerves are no longer interfered with, there's no stretching or traction, because that is important for their recovery. The more you can leave the nerves alone, the more you can not apply any heat at all on the nerves, they will recover faster. So with a retrograde nerve spare, we release the nerves much earlier, and we release them such that they stay in their natural state. We also use clips to control any blood supply, and this differs from surgeons who use a clip-less technique because they use heat in that place. And it's my philosophy that nerves should not have any heat near them, so I will always perform a retrograde nerve spare for my patients. To preserve your erectile function, nerves have to be spared. And most good surgeons can spare nerves very well, but it's also how they are spared. Are you limiting the stretch and the traction that occurs when you spare nerves? In my humble opinion, from the extensive experience from overseas at the Global Robotics Institute, retrograde nerve spare is the way that you can spare nerves and leave them uninterrupted. The other thing is that we don't use heat when we do retrograde nerve spare. We use the anatomy and we put a clip that is cold on the area where the blood supply enters. Clipless surgeons will do a heat instead of clips, and that negates the benefit of nerve spare, in my opinion. Now, you asked about urinary incontinence. It has been shown in studies that when you can spare nerves, the patient's continence recovers faster. There's other things such as the weight of the patient, the size of the prostate beforehand, and hence the defect and how many stitches are needed to close that defect. But certainly when you spare nerves, you gain an extra benefit of recovering your urinary control faster. The ideal candidate for a retrograde nerve spare robotic radical prostatectomy are patients with prostate cancer that is confined to the gland only, that hasn't escaped and invaded nearby organs such as the bladder or the urethra, or even extended to lymph nodes. Now, patients who have organ-confined prostate cancer can have robotic prostatectomy and can have the nerves spared. That's not to say that some patients who have prostate cancer that has invaded just on the outside of the lining on one side can't have surgery. They can. But to spare the nerves on the side with a more aggressive cancer would not be good surgical practice. And we often would have to sacrifice and take those nerves on that side, but spare nerves on the other side, and we will work with you until you get a good recovery and a satisfactory erectile and continence function. So after a radical prostatectomy, you'll have a catheter in while the bladder and the water pipe heal. During this time, it can be difficult to have a bowel motion in the early days. So it's important that you have lots of water, fruits and vegetables. And once the bowel motion happens, then all will be well with the bladder function. Now, after the catheter is removed, you will start on either Cialis, which is tadalafil, or Viagra, which is sildenafil. And that encourages blood flow to the nerves and the penile tissue and helps with rehabilitation. And with both nerves being spared in a retrograde nerve spare, I would expect erectile function to return within 2 months. Urinary control or continence will be helped by doing pelvic floor exercises after the catheter is removed. And similarly, I would expect urinary control within 2 months as well. So the advances in robotic technology are the robot has a camera that's a 30-degree angle and can toggle up and down with a simple press of a button. When I do a retrograde nerve spare, I can toggle the camera up to 30 degrees and can really release the nerves early during the phase of removing the prostate. And this allows the nerves to come off early and in their natural lie and state, and facilitates healing. The other advance is that the robot is a simple computer, and with the touch of a button, you can assess blood flow through different medications given at the time of surgery by looking at it in a different sphere or different visual field, and that can assist in preserving more nerve tissue.